Hello, I'm Sylvia Azania, and in this video, we're going to talk in depth about the presence of vacuoles in sperm. We will explain exactly what they are, how vacuolated sperm cells are classified, we will see if they have implications, and we will also answer some of the most frequently asked questions that users might have related to this topic. Intracytoplasmic sperm injection, or ICSI, is a widely used assisted reproduction technique. To perform this procedure, the embryologist introduces a spermatozoon directly into the egg in the laboratory with the help of a microinjector. In this case, the sperm that is microinjected is selected at a magnification of 400 times based on its motility and morphology. Nevertheless, a morphological evaluation of the spermatozoa can be conducted at a high magnification exceeding 6,000 times prior to the ICSI procedure. This capability enables a more accurate assessment of sperm morphology and provides superior visualization of the vacuoles located within the sperm head. This modified ICSI technique is formally known as the IMSI technique. These acronyms stand for intracytoplasmic morphologically selected sperm injection. Vacuoles and spermatozoa are physiological structures that develop throughout the process of spermatogenesis and sperm maturation. Despite this, the causes that lead to its appearance are not clear. These nuclear vacuoles are clearly visible as distinct concavities in the head of the sperm. They are formed from residual cytoplasm and cell organelles that are not needed but have not been properly removed during the sperm formation process itself. Their importance lies in the fact that these sperm vacuoles have been directly linked to failures in chromatin condensation. In any case, these vacuoles can only be detected when the sperm selection process is performed at high magnification. Therefore, these sperm vacuoles would be accurately and thoroughly assessed when performing IMSI, an intracytoplasmic injection of morphologically selected sperm, which would allow sperm with vacuoles to be effectively and reliably discarded. And before we move on to the content of this video, I would really appreciate it if you could give it a like and subscribe to the channel if you haven't done so yet, because that helps us tremendously to keep going and ensures that all the information we publish can reach more people. One of the most commonly used criteria for sperm classification when performing morphological evaluation at high magnification is the following. Grade 1, absence of vacuoles. Grade 2, 2 small vacuoles maximum. Grade 3, more than 2 small vacuoles or at least 1 large vacuole. Grade 4, large vacuoles and associated with other abnormalities. In this way, as the degree increases, the morphological alterations of the spermatozoa increase. The presence of vacuoles in sperm has been related to significant defects in chromatin condensation. This means that this non-condensed chromatin remains entirely unprotected and is, therefore, more susceptible to sustaining serious sperm DNA damage. Consequently, spermatozoa exhibiting vacuoles have been correlated with an elevated rate of sperm DNA fragmentation. Thus, if these spermatozoa containing vacuoles and chromatin condensation defects are successfully avoided and not selected for microinjection into the egg, it has been suggested that overall reproductive outcomes could be improved. With the implementation of IMSI, there could be an improvement in embryo development to blastocyst, implantation, and clinical pregnancy rate, and a reduction in miscarriage rate. However, the superiority of IMSI over ICSI is still not very clear in terms of improving these outcomes. This means that IMSI technique is not a standard or routine procedure in current practice in assisted reproduction clinics. And now we are going to answer some of the most frequently asked questions that users may commonly have regarding this topic. What test is done to see if there are vacuoles in the sperm? Vacuoles located in the sperm head become detectable when a sperm evaluation utilizing high magnification is conducted. In this case, the sperm are observed at more than 6,000 times magnification, which allows for a very precise evaluation of their morphology. Whenever this specialized high magnification morphological evaluation of sperm is performed to select the best sperm for microinjection in ICSI, this modified ICSI technique is referred to as IMSI technique. We would love to hear about your experience, so please share it with us in the comments section below. And remember that in the description box, you will find a link to an article where you can read much more information related to this topic.